All right, so you've arrived at the clinic, you're ready for your day. What's the first thing you do when you come in? Wash your hands. 60 seconds in the morning, 40 to 60 seconds. Scrubbing, lacing your fingers, get everything. The next thing you want to do if you're one of the first people is to go turn on the compressors and to turn on the water. Okay, so these two switches right here. When this light is on, you've got your compressor on, your unit isn't going to work. Nothing's going to go up or down. You won't be able to use any of the motors unless these compressors are on. Also, flick this switch. You want your water. Also, at the end of the day, double check. Everybody double check, and when you're done, make sure that these are off before you leave. Okay? Just push right on the light, and that shuts it off. Push right on that, and it turns it back on. Now that we've got our compressors on, we can go to our unit. You have to play with this a little while to get used to how it comes on and off. It's not a continuous turn. You kind of turn and it slides down, and the same thing when you push it up. It'll kind of go into a specific spot and you twist it in. Okay, so we've got the power off. We turn it and go down. There we go. If there's water already in here, you don't top it off. So if this was a little lower, I'm going to dump it all out and put new water in with a new tablet. So we'll show you where that is in the sterilization. Okay, I'm going to dump this out. We don't top it off. And right here we have our distilled water. If you look under here through this window, you want to see a green light. And if you don't see a green light, let an instructor know. We shouldn't be using that water unless it has a green light. Okay? So I'm going to fill this up. All right, we have our full bottle. We're going to put in an iodine tablet. Come over here to the clean side. This is the clean side. In this cupboard, you're going to have these tablets. I already have one waiting on the outside of the box here to save some time. Make sure this is full of water. You just drop your tablet in there. There you go. Okay, we're going to put this back on our unit. These also have directions here if you forget, for off and on. There's pictures on how to turn it. You're going to get it up in there first, and then just turn it. Okay, so once you have your water attached, then you turn your unit on. Okay? And that's on the side here. Here's the master switch. You can hear it start to engage. And this light should come on if your unit's on. A couple of things you should know today. There's an arrow that points down, makes your unit go down. There's an arrow that goes up, that makes your unit go up. And you'll need to know that before you start disinfecting your unit. One thing you want to do when you get here, make your unit go up and remove the foot pedal from under it. You don't want the chair to go down on that. So at the end of the day, you want to get that foot pedal up on there so that the people that clean can get around your chair. Okay, so now you have your water in the unit, you should run your lines. 2 minutes in the morning and then 30 seconds between patients. So we'll get some gloves on for that. You'll turn on your high volume suction. If you look at the images on here, there'll be an image that shows a puff of air and there'll be an image that shows water. So you're going to be pushing the button that has water coming out of it. Okay, so I've got my water, and then you want to somehow fulcrum. You don't want to just, this is a no-no. Don't just have this dangling in the air. So put your other finger here or fulcrum on here, and then push your water. And you do that for 2 minutes. Gets all the pathogens out of the lines, so it lowers the amount of pathogens in the lines, because if this sits there, they multiply. You want to get those out of there. Okay, we're going to pretend that this has been 2 minutes.
I am good at washing my hands. Get them wet 40 to 60 seconds in the morning when I first come in, because I'm coming in and I want to make sure any bacteria bioburden is removed before I start with patients for the day, and 20 to 30 seconds in between patients during the day. I can use a hand sanitizer between, within the same appointment. And I want to wash for 20 to 30 seconds between patients in cool water. And we have foot controls in here, which is kind of nice, so I don't have to worry about turning the water on and off. But if I was worried or I didn't have foot controls, I would use my paper towel after I'm done drying the hands to turn it off and wipe. All right, so I've washed my hands. If I just came in for the day, 40 to 60 seconds. And if it's between patients or within the same patient, 20 to 30 seconds. Now I'm going to don and doff my PPE that I'm going to use. I have my lab jacket on with a high collar and then cuffed sleeves. And then I have my masks. Here at the clinic, we use a KN95, and we've got 2 different kinds. We have one kind that is a loop, ear loop. Everyone is required to wear a scrub cap, and my scrub cap has some buttons on it. So I like this one to be able to put on and kind of hook to these buttons back here, so I don't have all that pull on my ears. And then I would clamp it down here on my nose. And then I would put my level 3 mask over top of that, also clipped on the buttons in the back. I would clamp that down. I've got clean hands at this point. I would put my safety glasses on, and the safety glasses are going to wrap around and have side shields. If someone wears their regular glasses, they would have side shields put on their regular glasses. I would have hand sanitizer, since I've just applied my glasses and my masks. I've got hand sanitizer that I will use before I put my gloves on. I want to make sure that I use enough hand sanitizer that gets it wet for 20 to 30 seconds, but then I need it to dry before I can put my gloves on. I will put on my gloves. I already know that I am a medium glove. My glove will go over the cuffs of my jacket. And then at this point, I'm ready to go. Now, getting them off, I would pinch at the wrist so that I'm kind of wrapping them into each other. I would pull the glove off inside out. Then I would use my finger under this edge to pull it through, and then I can throw the gloves away with minimal touching. Could hand sanitize, or I could just take my mask off with my pinky. If I was finished with that patient, I would dispose of the mask. So I'm going to put them right here because I'm going to demonstrate the other kind of mask in just a minute. And then at that point, I would be able to take my glasses off. I would wash my glasses. I would spray them with the Cavicide wipes, but then I would also wash them off, because otherwise a film will collect on that lens and the glasses will be ruined very quickly. So after I use the Cavicide, I wash these with soap and water at the sink. And one thing that I wanted to demonstrate is I showed you this mask with the ear loops, and I like that because it hooks on my buttons. If I didn't have buttons, I think I would like the other kind better. This goes behind your head. So when I put this on, and I'm going to use a new mask for every patient, I'm going to put this around my head, clamp it around my nose, put my level 3 over top of that, make sure I'm completely covered. Put my glasses on underneath my scrub cap. Then I would hand sanitize. I would use enough where my hands would be wet for 20 to 30 seconds. And then at this point, I would put my gloves on. And when I put my gloves on, I am looking for the gloves to go over my cuff. I'm not going to have any rings, any jewelry. My nails, I'm not going to be able to see them over the palm of my hand, so they're going to be short and well kept. I'm going to put them over, and then I would be ready to go for patient care. To wrap them within inside of each other. Whoop! Not drop it on the ground, drop it in the garbage. Okay, now we're going to do unit disinfection. So we have come into the clinic, we've washed our hands first thing. We have filled up our water bottle and we've put the iodine water tablet in there. We have run our lines through the unit to make sure that there's no biofilm from the lines, and now we're going to wipe down the unit. We've got the chair up to clean it so that we can reach everything. We have these PDC Care wipes that we use here at the clinic. The first one is to clean off the bioburden and to clean the surface. The second time around, wiping exactly the same, is the disinfection step. So you're coming into the clinic, you are using a chair that maybe somebody used yesterday, and you don't know how well it was cleaned. If you assume that it was cleaned well, but you want to know for yourself that everything is as clean and disinfected as possible. I will use a number of wipes on this. It's not just one wipe and done. I will use a number of wipes on this. I'm going to turn on my unit, and I'm going to wipe from the area that is most critical to least critical. So that means that this area right in front of the patient is probably the most critical. I've touched this a lot during my treatment. I've touched these sections potentially a lot during treatment. So those I would consider the most critical. I want to make sure that even though the light was covered with a light handle cover and some barriers, I still want to make sure that there wasn't a touch around here. So I will be, conscious to keep the light down and take a look at that as I'm cleaning. And then the chair will be cleaned. When I'm doing these tubes, and I'll demonstrate this in just a second, but when I'm doing these hoses and tubes, I want to do the whole length of the hose all the way up, because there could be a time where something got on these hoses, and you wouldn't want a patient sitting in the chair that was looking around and saw, a spot of blood or debris on any of the hoses. Even though this might be clean, they would think like, oh my gosh, what else is not clean? So I'm going to take a couple wipes out of here. I'm going to set here. But I'm going to start with this unit. This is the brake on the unit. So when I push this, if I try to move this up and down, it does not move up and down unless I push the brake in. So I push the brake in and I can get this down to my level. Usually there is a tray sitting up here. So I would wipe my tray first, the top and the bottom of my tray, and then I would wipe this tray holder all over. If I knew that I was doing a cleaning step and there was a lot of, blood, saliva, bioburden, whatever, to wipe off, then I might be ready, even right now, for another wipe. I'm going to remove all of these from their holders. I'm going to wipe all the way down the length of that, and I'm cleaning it at this point. I'm going to wipe in between and all around within the holder. Even this one, there's nothing there, but there could have been a splash or something that got in that area. This is where we would have our handpiece hooked up. So the whole length of that cord. And keep in mind, this is just a cleaning step. I'm going to do this again for disinfection. I'm going to wipe. This is where our Cavitron hooks up. Whether or not I use the Cavitron, I'm still going to wipe the whole length of that. And within here, all these little crevices. And then this is just an extra one that could be used for a slow speed, which is our polishing or our slow speed motor hookup. All right, I'm going to get another wipe, and then I'm going to, since this is taping me from that side, I'll wipe the light, I'll wipe the side of the light, the back of the light. All of this was covered, so I should just have to kind of lightly go across. And then even this has a shield on it, so I can wipe across the shield. Over time, this will get kind of clouded up. So I will be able to remove this, every couple months and replace that piece. We have a few lefties in this class, and we have a few lefty instructors. So we would want to wipe this one and have this one covered if you knew that you were going to have a left-handed instructor that day, or if you were a left-hander yourself and needed to cover the right hand for your right-handed instructor. I would get another wipe. You can see this is already wipe number 4-ish. So I'm going to clean the suctions and all the way down. Try to have them not tangled up. I'm going to go in this. In every unit, you would be able to kind of move this suction and twist it a little bit to, your liking as far as the suction placement. These would have been covered by barriers, so you hope that underneath here there's not a lot of, debris or gunk that you need to worry about, but we're still wiping them. Anytime we take a barrier off, we still wipe. And I'm kind of wiping and turning it on and off as I'm wiping. In here, in here. And this is still my cleaning stuff. When you think like, oh my gosh, this is taking me a long time. Yes, it is. We got a lot to do. I'm just wiping this while I'm here, in case I grabbed it with a hand along the way. Okay, I'm going to do another wipe and do my chair. I'll keep going over the J unit as I'm reaching. And you can see how it's wet here. I'm going to wipe this top part first, and the handles. The patient might have been holding onto the handles. I might have adjusted the headrest, or I might have touched down the back. And I'm going to wipe the back. And then my last wipe, I'm going to wipe down here. Nothing should have been there but their feet. I still want to take care of my unit and make it, so it's presentable and lasts a long time. And this is my one wipe, my cleaning wipe. Now I'm going to go back exactly the same way, and I'm going to disinfect. So I would have a tray up here. I would do my tray first, because once you've cleaned, you want the surfaces to stay wet for at least 3 minutes. So you want to do your most critical area or your tray so that you would be ready to prepare your tray for barriers. So I would do my tray. Now I'm doing my tray holder, bottom side. I've already cleaned it, so there shouldn't be any debris, but now I'm doing this step to disinfect. I'm doing it exactly the same. I'm not doing it any less. The other step I may have had to do more if I saw more debris. And I'm going down all of the tubing, all of the hoses. Again, all the way up. Hoses. Alright, get another wipe. Alright, I'll do this since I'm on this side. Again, just obviously it will be covered with a barrier, but I want to make sure that everything's disinfected. I'm going to come over to the suction tubing. again, all the way up that tubing. If I feel like this is drying out or I need a new wipe, I will get a new wipe. On and off. Like I said before, that is covered with a barrier, but the barriers move around and aren't 100% always, so rather be safe than sorry wiping things. Another wipe for the chair. You should be able to see the surface stay wet for 3 minutes. That's the contact time that we need for the wipes that we use to disinfect. Now in this room, I've just done the barrier, I've just done the chair, and I have done the bracket tray before I put on barriers. But in your clinic rooms, there are some shelves, and there is a black table that you would also do. And your chair that you have, which I'll grab this chair here, your clinic chair will also be wiped off. So you would do this during and it was kind of pushed over in the corner, so I didn't grab it at that point. But you would also do your clinic chair. And you would do the clean step. Even taking care to do these handles down here, because you may have raised yourself up or down or adjusted something on your chair. So you would do this at the same time that you do your cleaning stage and then your disinfecting stage. You may have grabbed it with a hand or adjusted it with a lever. So this also needs to be done. Even though you think I was just sitting in it, it was covered. Nope, that has to be done as well. So your chair, the bracket table, which of course is your most critical area, your light, your suction, anywhere around the chair, and then your operator chair, as well as your table or your shelves in the unit. You guys have nice cabinets that are able to be wiped. So your cabinets, because there is aerosol that comes from that patient's mouth exponentially and hits kind of everything around in the area. So everything in your room, depending on the design, that's close, your cabinets and such, would also need to be wiped in the cleaning and disinfecting stage. When we come in and we turn our unit on, we are also going to turn our jade unit on. The jade is a filtration unit that we have in every room, and we happen to be demonstrating in an x-ray room, so not every room has an x-ray unit in it, but every room has a jade unit in it. This middle button right here turns the jade unit on. So when you see that it is green, you would know that the jade unit is on. If I wave my hand over that, you can hear it kind of go and filter a little bit more. It filters on its own, but in the morning, make sure that this is on. And then when you are done with patients, make sure that this is turned off, again, by pushing this middle button. All right, so we have a couple tray setups here. This tray setup is one that we would use if we were having a patient and we were going to be completely ready for patient care. We would have a keyboard cover, we would have a headrest cover. These are underneath in the sterilization room. We will show you that tomorrow during lab. We would have a patient bib, we would have a bib chain, we would have 5 of these covers, and I'll show you where these covers go. We would have a saliva ejector, an air water syringe tip. We would have 1 cotton tipped applicator, and then we would have, a couple of gauze squares. I tend to like a little bit more gauze. If you know you're only going to use 2 or 3 pieces, that would be your minimum. Then we have the patient's pre-procedural rinse. We also, on top of having a pair of safety glasses for us, we would also have one for the patient that was clean and available for them to wear, because all patients and operators are required to wear safety glasses. So while we're in lab and we are practicing, there is a lot of waste here. We will use the air water syringe. Sometimes we will use the suction, depending on if we're seeing partners or not. We might use the gauze or the cotton tipped applicator and the pre-procedural rinse, and then we would cover these so you get used to the idea of them covering. So there's a few less barriers here on a day-to-day, especially when we're just working with our typodont. We wouldn't need minimal, if any, barriers. So this would be working on student partners doing, a quick look or an extra-oral exam or something like that. But this is our setup. One thing that we have, which some of the students are still using, is this overglove. If you need to get in a drawer or if you need to grab something and you have your gloves on, you could have this overglove available. I know that some students will just take their gloves off at this point, and I think that I'm okay with that. If you have this overglove, and it's about half and half at this point. This is kind of a sticky square here. You would tape the square down, and we've got tape and the squares available at each set of units, because we have 1 sink to 2 units. So if you taped this down with the sticky side up and kind of made a picture frame out of it, like I said, we're about half and half, so some people like this and use this, and some people really don't. You would have a glove here. We would stick it down, and it would be used like if you had your glove on. I've got my gloves on, and I'm doing something on the patient, and I dropped my gauze or my something that I need, and I need to get in a drawer. I could slide my contaminated hand in here. Get my fingers right, and then I could open a drawer, get something out, put it up, just drop it on my tray, and then put this glove back, and then still go back to my patient. Any contamination would be inside of this glove. The outside I would be able to touch. The other alternative to that is if I dropped something or needed something, then I would just take my gloves off, wrap them inside of each other, hand sanitize, and then go get whatever I needed, or reach in the drawer and get whatever I needed. So, and like I said, we used to use this with every single patient, every single time. And I feel like if the students aren't using it and they know they're not going to use it, then let's not waste this barrier. So that's the only thing that is not universal within the clinic. All of the rest of the barriers are going to be the same at every unit. So it's universal precautions, and we're covering the same things. All right, so I've got my barriers, and I've come back from the sterilization lab with all of my barriers. I will put this cover over my headdress, so that if I need to adjust, there's little crooks and crevices in there that, could collect debris. So anything that has a little extra, I want to put a cover on. So this has a button that I can push in the brake to move my unit up and down. So I would put one around here. I would put one here, and just around my light here. Put one on the air water syringe right here. I will put the air water syringe tip in first. If you put it in second, sometimes plastic can get caught in here. So I will push it in, and then I'll kind of give it a little pull to make sure that it's in there secure. There's a couple little notches, and these notches right here are what holds it in. So I'll push and make sure it's all the way in, and I'll kind of just give it a little tug. If it's not all the way in, the minute that you go to spray with your air or water, and you can see the little puff of air versus the water, the minute you go to spray, this will fly off. So I'll put it in here, and I just kind of pinch the corner and wrap it like that, because these buttons are hard to clean around. As far as these go, I'm not going to put any barriers on these. I'm not going to put any barriers on there. I am going to put them on the suctions on the other side. So depending on what part of the procedure I'm at would determine how many suctions that I'm going to use. We're always going to have the saliva ejector, or the low volume, able to be used. This saliva ejector straight, it's got a metal piece in it, so you can bend it when you're using it for a patient. You can bend it. A lot of students, I'll see them going at the patient just straight at them, but you can bend it to make it more comfortable. And put that over. And again, I'm going to pinch the corner. I'm going to try not to get anything caught in here. Sometimes that little piece will get caught. I'm going to show you my suction isn't working. And there's a little piece of plastic caught. So I pull that down. If I was going to use one of these, I would also have the suction tip, and I would have a barrier on it just like this. We will use these. This is a high volume suction, so we have high volume suction tips, and then we have some that have a mirror on them that we use in this. That's a little wider. If we had our keyboard, we don't have a keyboard in here, but we have a keyboard cover that we would wrap our keyboard in, and then we would also put some blue tape on the end to secure that onto our keyboard. So that would be on our keyboard over here. Now, as far as our blue tape goes, there's going to be some places that we use this blue tape. We don't have a good cover or a good barrier that fits around this, so we cover this so that when we touch this, we are not having to really clean and disinfect that and then keep that really wet since it's electronic. And the same thing up here. As far as the light goes, we turn it on right here. So kind of the back of our hand can turn it on, or a finger. So we will cover that with a barrier. There is a place on the side here where we can adjust the light. Usually we don't mess with that too much. You put a cover here. And usually if I'm a right-handed operator and I'm on that side of the chair, or if I was left-handed on this side of the chair with my table, this would be used maybe by your instructor when they come in. You probably wouldn't use this one a ton, but somebody may. So if we had a left-handed operator or a left-handed instructor, you would use both of these. So both of those would be done. And we do have 4 left-handed students in the class this year, so in most cases we'll probably have those both. Barrier goes on our computer handle, because we'll have a computer screen that we can build, that we can bring towards the patient. We are doing this demonstration while the students are in clinic, so this is kind of our extra x-ray room, extra unit, so we thought this would be a good place. But we don't have the keyboard that we would need to cover, and we don't have that computer monitor that we would need to have this on the handle as we pull it close to us. So those 2 things are missing in this room. When you are wiping down and disinfecting, you still have your shelves and you have some more cabinet area that needs to be wiped in the rooms in the clinic. But this was a good place for us to come and hide out and make this video for. All right, an explanation of when you would use gloves versus clean hands. When we are wiping down and when we are cleaning and when we are disinfecting, we would be using gloves. We would have gloves on for that whole procedure. You know, we come in from the outside, we wash our hands, we do the water bottle with clean hands, and then after we get back to our unit, turn it on, have the water bottle on, then turn it on. We would then put our gloves on to start the cleaning and disinfecting process. We would have gloves on for that point. Once we've got everything cleaned, everything disinfected, we've done the wipes twice, then our unit is drying. The contact time is at least that 3 minutes, and we would wash our hands, take off our gloves, wash our hands. Then we would go to the sterilization room. We would be on the clean side and we would get our tray set up. Once we get our tray set up out of the sterilization lab, we would bring that back with clean hands, and then with clean hands, we would put on all of our barriers. When we bring our instruments in, our instruments are in a package and they're wrapped, and we will be going over that over the next couple weeks of wrapping our instruments and the storage and the care for the instruments. But that instrument cassette would be off on the side until we see patients. We want to unwrap that instrument cassette onto our tray table. We want this as sterile as possible. We would unwrap that with clean hands, throw that wrapping away, and then we would hand sanitize and put our gloves on and be ready for patients. We should never leave our area or our chair with gloves on. If you're walking around the clinic with gloves on, nobody knows if they're clean or dirty. You might say, oh, they're clean. I don't even want to see it around the clinic. Once you are leaving your chair and leaving your patient, your gloves come off. If you dropped something or need something and you can't flag somebody down to get it, your gloves would come off. You would be hand sanitizing on your way to go retrieve what item you forgot or need to additionally. The only two exceptions to having your gloves on away from your chair would be when you are taking your instrument cassette after you have seen your patient. You would take your cassette, your closed cassette, in your gloves to the sterilization room and place that cassette in the hydrum. After it's placed in the hydrum, which is going to sanitize our instruments, it's kind of like our instrument dishwasher that we've been talking about. As soon as I have placed my instruments in there, my gloves would come off and I would hand sanitize on my way back to the unit. The only other time is if you are doing appliance care. So you've come from the sterilization room, you've went to the clean side, labeled a bag, and got a bag ready so that you could retrieve and clean a patient's denture. You would walk back to their chair with gloves on, have them do a no-touch technique, placing their denture in the bag of peroxyl, and then you would close it up and we would go back to the lab, place that in a cup for disinfection for 10 minutes. And you would then immediately take your gloves off. Those two scenarios are the only times you would have gloves on away from your chair. When you are doing denture care or you're taking your instruments at the end of your appointment back to the sterilization lab to place in the hydrum. All right, at the end of the day, we are going to run our suction lines. We're going to run some cleaning solution, some enzymatic solution through our suction lines. So the students already have these containers made up for this afternoon, and they have one pump of the Maxizyme dual enzymatic detergent. So one full pump goes in here first, and then they fill it with water to this top. So they fill it to the top with water. And then this is used half for one unit, and then you push it to your neighbor, and it's half for the other unit. All right, at the end of the day, we are going to run our enzymatic cleaner through our suction lines. So even if you haven't used them, we will run it through all of the lines. At this point, I've got clean hands. My unit has been cleaned and disinfected. I have the solution in here. I will use half of this jug of solution. So I will turn the suction on and kind of in and out, suction a little bit down. That's pretty powerful. Suction a little bit down each of these suction tubing. Usually I would do a little bit more in the saliva ejector because of the skinnier line, and I know that I probably used this a little bit more during my appointment overall. Although if you know that you have used the Cavitron and have used the others, make sure you do it enough in the other. Here. Out until I've got it halfway done. And that is our end of the day running the enzymatic cleaner through our suction tubing.